James Zimmer was a talented carpenter and a son and a brother. In February, he took his own life minutes after he was discharged from psychiatric care at Royal Jubilee Hospital. No one told James' family that he had been released from involuntary care. Today, they brought their message to the legislature.
We need you to be the leaders you have set out to be by actioning urgent changes that are needed.
Existing rules clearly state family must be told when a patient is being discharged from mental health care. The BC Mental Health Act stipulates facilities must give notice to a near relative of a patient immediately after discharging the patient. No permission is required from the patient if a primary caregiver is actively involved in their care. A lack of compliance with the regulations has become a disturbing trend. James's story is not unique. Aaron Samuel was a successful BC entrepreneur, a young father and a son. In 2021, he killed himself days after he was released from involuntary psychiatric care at Lions Gate Hospital. Despite 8 calls in 5 days to the hospital, Aaron's family was excluded from his care and recovery plans.
So I'd like to know what can be done to strengthen existing regulations to ensure that when family members come into care, that their family and friends are notified and involved.
Family questions about why the rules are not being enforced have remained unanswered.
Will the minister make the necessary policy changes so other families don't have to experience the premature loss of a loved one?
And what we continue to do is adapt clinical standards to ensure that they can fully involve families as much as absolutely possible.
James Zimmer's family has formed a non-profit society. Through Connect to Protect, the hope is to push for more supportive and effective mental health crisis response care.
I know that nothing can bring James back.
The horn, they say, is an SOS call to government in a bid to turn anguish into an opportunity to advocate for change. Belle Puri, CBC News, Vancouver.